If you have a cough without phlegm caused by certain infections of the air passages, such as sinusitis or the common cold, Robitussin ER may provide temporary relief. However, it should not be used for an ongoing cough from smoking or long-term breathing problems unless directed by a doctor. Robitussin ER contains dextromethorphan, a cough suppressant that works by decreasing the feeling of needing to cough. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years old, so it should not be used to treat cold symptoms in young children unless specifically directed by a doctor. Always follow the dosage directions carefully to decrease the risk for serious side effects, and do not use this product to make a child sleepy. Additionally, be cautious about giving other cough and cold medication that might contain the same or similar ingredients, and ask your doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Robitussin ER oral suspension, it's important to follow the instructions from your doctor. You should take it by mouth every 4 to 12 hours as needed. If you experience stomach upset, it's recommended to take it with food or milk. Make sure to use a medication measuring device to get the correct dose, and shake the product well if you are taking a suspension. The dosage will depend on the product you are taking, your age, medical condition, and how you respond to the treatment. If you are using this medication without a prescription, make sure to follow the specific dosing instructions on the packaging. If your doctor advises you to take this medication daily, it's important to take it regularly to get the most benefit from it. To help you remember, try to take it at the same times each day. Abusing this medication by taking a higher dose, taking it more often, or using it for a longer time than prescribed can lead to serious harm, including brain damage, seizures, or even death. Make sure to stop the medication when directed by your doctor. If your symptoms persist or worsen after more than 1 week, or if you experience fever, chills, headache, or rash, it's important to inform your doctor as these could be signs of a more serious condition. Some people may experience slight drowsiness/dizziness, nausea, or vomiting when taking this medication. Rarely, severe drowsiness/dizziness may occur with normal doses. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. While rare, a very serious allergic reaction to this drug may occur. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not mentioned here, it's important to contact your doctor or pharmacist. Remember, in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this medication, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any inactive ingredients that may cause allergic reactions. Also, be sure to discuss your medical history, especially if you have lung problems such as asthma or emphysema. It's important to note that this medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's best to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. It's also important to avoid alcoholic beverages and talk to your doctor if you are using marijuana, cannabis. Additionally, this medicine may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, be sure to consult your doctor or pharmacist before using this drug. For pregnant women, it's important to use this medication only when clearly needed and to discuss the risks and benefits with your doctor. Similarly, it's unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be cautious about potential drug interactions when taking Robitussin ER 30 mg per 5 ml oral suspension, extended-release antitussives. Certain medications may interact with Robitussin ER, affecting how it works and increasing the risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious, possibly fatal, drug interaction. These include isocarboxazid, metaxalone, methylene blue, moclobamide, phenelzine, procarbazine, razagiline, sulfinamide, selegiline, or trenylcypromine. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. It's important to ask your doctor when to start or stop taking this medication to avoid any potential interactions. Some products that may interact with Robitussin ER include other medications for cough, such as hydrocodone, over-the-counter cough/cold products, and rolapitant. Always consult with your doctor or pharmacist before taking any new medications alongside Robitussin ER. If someone takes too much Robitussin ER 30 mg per 5 ml oral suspension extended-release antitussives and has serious symptoms like passing out or difficulty breathing, they should call 911. Otherwise, they should call a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include fast heartbeat, vomiting, sweating, nervousness, feeling high, euphoria, hallucinations, problems walking, staggering, agitation, severe drowsiness. Make sure to keep all of your medical and lab appointments to ensure that you are getting the most out of your treatment with Robitussin ER 30 mg per 5 ml oral suspension, extended-release antitussives. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to follow their guidance to get the best results. If you forget to take a dose of Robitussin ER 30 mg per 5 ml oral suspension, extended-release antitussives, take it as soon as you remember. If it's close to your next scheduled dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Remember to always follow the recommended dosage instructions for this medication. It's important to store Robitussin ER 30 mg per 5 ml oral suspension extended-release antitussives at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of this medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.